Welcome to our video on flexible cystoscopy. Today, we'll be discussing the possible risks associated with flexible cystoscopy, as well as the surgical procedure itself, to help you make an informed decision about this procedure. I am Dr. Fabio Castiglioni. Avatar created using artificial intelligence. I am a consultant andrologist and urologist at Holistic Andrology in London. I am here to bring you the facts. Flexible cystoscopy is a diagnostic procedure to examine the inside of your bladder. It can also be used to take biopsies from your bladder, remove ureteric stents, or administer Botox injections into your bladder. It is usually performed as an outpatient under local anesthetic. Mild burning on passing urine is common after the procedure, but side effects are rare. What this procedure involves: telescopic inspection of your bladder and urethra, water pipe under local anesthetic. We can also take small bladder biopsies, remove a stent from your ureter, and inject Botox into the wall of your bladder using this technique. What are the alternatives? Rigid cystoscopy under general anesthetic. Your urologist will advise you if this is necessary. No treatment, which may leave the cause of your symptoms unexplained. What happens on the day of the procedure? Your urologist or a member of their team will briefly review your history and medications and will discuss the surgery again with you to confirm your consent. We normally carry out the procedure under local anesthetic. We may give you some antibiotics before the procedure after you have been checked for any allergies. We instill a jelly containing local anesthetic into your urethra and leave it in place for a few minutes. This makes introduction of the telescope as comfortable as possible. We put the cystoscope into your urethra and pass it into your bladder. Men sometimes find that passing the telescope through the prostate is a little painful. This only lasts a few seconds. Once the telescope is in place, we run sterile water slowly into your bladder so that we can inspect all the bladder lining. If we find an abnormality inside your bladder, we may take a biopsy using a small pair of forceps passed through the telescope. If you have had a ureteric stent placed previously, we can remove it using a pair of forceps passed through the cystoscope. A nurse will remain with you throughout the procedure. We remove the telescope once we have completed the examination. The procedure usually takes no more than a few minutes to complete. You will be able to pass urine, wash, and dress yourself after the procedure. The doctor or nurse will explain the findings to you. The procedure is normally performed on an outpatient basis, so you will be able to go home straight afterwards. The possible after effects and your risk of getting them are shown below. Some are self-limiting or reversible, but others are not. The impact of these after effects can vary a lot from patient to patient. You should ask your surgeon's advice about the risks and their impact on you as an individual. Mild burning or bleeding on passing urine for a short period after the procedure occurs. Almost all patients. Infection in your urine requiring antibiotics occurs between 1 in 50 and 1 in 100 patients. Your risk of getting an infection in hospital is between 4 and 6%. This includes getting MRSA or a Clostridium difficile bowel infection. This figure is higher if you are in a high-risk group of patients, such as patients who have had long-term drainage tubes, for example catheters, bladder removal, long hospital stays, multiple hospital admissions. Thank you for watching our video on flexicystoscopy. We hope it was helpful to you. If you like what you see here, make sure you subscribe so you can see new videos.